So EMDR therapists are underutilizing a really powerful tool in helping their patients, and that is bilateral alternating stimulation in the tactile form. We're going to call that BLAST, okay? Now, BLAST has not been shown to increase dissociation, so you don't need to worry about using that out of the office. What I would not encourage your patients to do is I would not encourage them out of the office to use the eye movements, okay? But the BLAST is fine for out of the office. We have EEG data that shows that it actually reduces stress. And if you're in the middle of processing a target, your patients are going to be going into states of anxiety and stress in between sessions with you. And what you can do is you can get out of the box and out of the office and allow them to have the bilateral alternating stimulation technology whenever they want. So I'm going to summarize a study that was done by Amano and Tiochi in 2016. You can find this on Google Scholar. It's the role of alternating bilateral stimulation in establishing a positive cognition in EMDR therapy. Now, this is a multi-channel near-infrared spectroscopy study, which is really neat because what they did was they measured oxygenated hemoglobin. You know, a lot of studies measure subjective units of distress and patients' awareness and things like that. This was actually a study of oxygenated hemoglobin, which is an index of brain activity, and they found some really important changes in brain areas associated with peaceful feelings and calm. And they found that during the attempt at bringing someone into their positive cognition, they found that compared to controls, individuals that had bilateral alternating stimulation in the tactile form, BLAST, had a greater sense of relaxation, a greater sense of emotional processing, and experienced more comfortable feelings when they were thinking about the positive thought. And this is really important because there's studies emerging now that are really showing their brain-based differences in the effect of using bilateral alternating stimulation in tactile form. In this particular study, they used a cumbersome wire device, but now you can use this with your patients in wireless form with TouchPoints. Okay, so what I do with my patients is I tell them, depending on what's going on with them, they can use TouchPoints about 15 minutes before sleep if they're having a hard time quieting down the racing thoughts, or if they're distressed. If during the day they just well up with some of those distressing feelings, even if it's not linked to a cognition, we're not asking them to actively process the 8 phases of EMDR therapy when they're using this. This is just to desensitize some stress and help their bodies go into more parasympathetic nervous system activity. Doing cognitive behavioral therapy, why not use BLAST technology while you're going through prolonged exposure? It may lessen the length of treatment and may also lessen the distress that the patient has to go through to actually go through that therapy. Same thing goes for obsessive compulsive disorder treatments and some of the other things. So now you have some tools to actually help your patients when they're not in the office with you. And I hope that that's helpful in allowing you to be the best therapist that you can be.